Hello and welcome to the Medical Careers video on Obstetrics and Gynaecology. My first question is, who are you and what is your title?
My name is Nair. I'm a consultant obstetrician and gynecologist.
Thank you. And how did you become a consultant in obstetrics and gynaecology?
I trained in India and then I moved to UK. I had done some work in obstetrics and gynecology in India, and I did a first job in UK in the same area. And I think I liked it so much that I wanted to continue my training and complete it. So I applied for a training post and was given one in the KSS Deanery. I completed my training in this area and applied for various jobs, and here I am.
Interesting, thank you. And what do you do on your average day?
There is no average day, which for me is one of the attractive things about the specialty. I think we can talk about an average week, and I could be on call managing all the women walking in with emergency problems in gynecology or obstetrics. Or I could be in a clinic where I could be dealing with pregnant women with cancer screening or with gynecological problems. I could be in theater doing a planned cesarean section or doing gynecological operations. So there is variety.
I guess that plays into the next question a bit as well. So I was going to ask, what happened to you on your most interesting day at work?
Okay, so that's again a difficult one to answer because there have been so many interesting days that I cannot flag up a single one. But I'm going to talk about the day when one of my colleagues' daughter-in-law was brought in. She was 28 weeks pregnant and came with abdominal pain. And I diagnosed an abruption, which is an emergency. I wanted to do a cesarean. I remember pushing the trolley myself into the theater to avoid any delay. And I can tell you that the baby survived, is thriving, and I'm updated by a proud grandma with photographs, news all the time.
That's lovely. And what advice would you give to someone looking to get into obstetrics and gynaecology?
Training lasts for 7 years and includes basic, intermediate, and advanced training. Following this, you have the option for subspecialization. If you're interested in joining Obs and Gynae, then you should try and do a short placement so that you can be exposed to some of the things on offer. And I would also suggest that you do a project, something like an audit or a small study or a case report, which would make you stand out when you apply. And the other suggestion would be to look at the Royal College of Obstetrician and Gynaecology's website, which has a lot of information for people interested in joining the specialty.
Thank you. And finally, for my final question, why should someone choose to work in obstetrics and gynaecology?
Well, a career in Obs and Gynae would be flexible, exciting, and rewarding. It would be at times demanding and challenging, but it would always be varied. And as you do the basic training, you'll be exposed to various options, and you can selectively focus on the areas that interest you or suit you. You could be an obstetrician interested in fetal medicine, maternal medicine, perinatal mental health, intrapartum care, or you could be a gynecologist specializing in cancer care, urological problems in women, couples with fertility problems, or you could specialize in minimal access surgery. You could be an academician who's researching into women's health. So it's also a very exciting and evolving specialty with advances in fetal medicine, increasing our ability to diagnose and treat problems in utero. There are advances in fertility management, in minimally invasive surgical techniques, and it's also an outward-facing specialty, and Royal College of Obstetricians and Gynecologists has global links with other countries and is working to improve women's health in other countries too.
Excellent. Great answer. That's all my questions. Thank you so much for joining me, Minnie.
Thank you. It has been a pleasure. I hope that I have encouraged at least a few of the doctors looking at this video to join my specialty.
Thank you.